Happy Monday, everybody. How are you doing? I'm not comfortable. There we go. How are you guys doing? I'm Alexandra. I'm founder of Life with Herpes. I'm excited to be going live with you today to be answering your herpes questions. You can go on ahead and just ask your questions here. I will get to them. I haven't been able to get to all of the questions. I've been getting hundreds of questions each time we go live, and I can only get to like 100 of them, not like 300 of them. So I just want you all to know that I do my best to answer your questions and get to them. So if you were just joining, my name's Alexandra. I'm founder of Life with Herpes. I was diagnosed with oral HSV1 in 2003 and then genital HSV2 in 2011. So I've been living with herpes for a very, very, very long time. And I didn't go public about it until 2017. So that's when I decided to go public. And it was very scary, very terrifying. But I did it because I realized that there were other people like me. I was living with so much fear. I was living with the thought that no one would ever accept me. I wouldn't be able to date or marry someone that I fell in love with or have the life that I want. And I truly believe that. And I believed that I was gonna have to settle. And that's not true. So you don't have to do that. So go ahead and ask your questions here. They can be anything from what does herpes look like, dating, how to disclose, difference between HSV1, HSV2, oral and genital, how to prevent outbreaks, supplements that I like to take, things like that. And if you know anybody that this really resonates with, if you're like, oh my gosh, my friend just got diagnosed, or I know someone that has herpes, or whatever, if you think someone needs to hear this message, please share it with them so that they can get that message out. So someone says, hey, I think I have herpes down there. How do I go about it and get an examination? So my favorite way to get examined is a telehealth way. It's through Herp Alert, HERPALERT. If you use the promo code Life with Herpes, they do give you 10% off. What I like about Herp Alert is it's telehealth. So you don't have to leave your house. You can set up a appointment. You can either talk to them on the phone or a Zoom or a Skype or whatever. You upload the photos of your potential outbreak, and doctors will be in touch with you same day. So you'll be able to get that diagnosis that same day. And like I said, I love Herp Alert. So definitely go check Herp Alert out. If anybody's here going, I think I may have herpes, I think I don't know. If you're in doubt, go get tested. The worst thing that you can do is be like, oh, it cleared up, because herpes does clear up. And then you don't know. And then you're out and you may be transmitting it to somebody unknowingly. So the best, I know you may not want to know, but the best is to know. How is pregnancy and living with herpes? Pregnancy was, I loved being pregnant. During my last try, I definitely had more outbreaks, and I had it was pretty much back-to-back outbreaks, because obviously there's a lot of stress on your body, and you're having a baby and you're freaking out and you're like, oh my gosh, what am I doing with my life? I'm like gonna have a baby. But as far as delivering the child's not at risk. I don't like using the risk, but like child's not at risk of getting herpes until the delivery. It's skin to skin. So it's not in our body fluids. We're not gonna transmit it to the child in utero. The times that we need to worry about being herpes transmitted is when the child is out or during delivery. But we worry so much about delivery, and we forget that there's people that are going to be in your child's life that have herpes as well, whether it's oral or genital, and they will be in contact with your child as well. So we put so much emphasis on ourselves of being like, oh my gosh, I don't want to infect my child. But grandma or grandpa can go give your child a kiss and accidentally transmit herpes. So it is possible for that to happen. And I really appreciate the hearts, you guys. So thank you for that. I like seeing them, and I'm into hearts now because my little boy is a Valentine's baby. So hope you get better. I'm fine. So thank you. I'm fine. 80% of the population has herpes. So 2 out of 3 people have HSV1 and 1 out of 6 have HSV2. So there's a lot of people living with herpes. Most people don't know they have it. In fact, 90% of the people with HSV2 or genital herpes don't know they have it. So there's a lot of us that don't know. How many times do you get an outbreak a year? So HSV1 oral, I get one like maybe my second oral outbreak was 14 years later. So I don't get those often at all. In the almost 20 years that I've had it, I think I've had 3 outbreaks, that's not a big deal. As far as genital, that's something that is definitely more difficult for me. There's times I've been back to back to back to back, and there's other times it would be years. Recently, I was just, I think like 8 weeks in between my last outbreak, which I know why I got it. I know what caused it. It was stress, and I knew that I was stressing myself out, but I didn't know how to fix the stress other than just go through the stress and get through it. So that's what happened there. I feel like I have to sneeze, so I apologize. Stress is what causes outbreaks. Personally, for me, it's the stress on my immune system. It's the stress on my nervous system. Why is my tongue blue? My tongue isn't. I just ate some chocolate. My tongue isn't blue though. Thank you for the hearts. Okay. Someone says, okay, I think I have herpes down there. What do I do? So Liv, I was saying earlier, go to herpalert.com and use the promo code LIFEWITHHERPES, all lowercase, all one word. They will give you a discount, but they will talk to you. They'll work with you virtually today. So why do I call to get a blood screening? Blood screening. So there's a couple of different ways to be diagnosed with herpes. So Herpalert is a clinical diagnosis. They're going to look at your symptoms. They're going to talk to you. They're going to find out what's going on. And they're going to look at, do you have an outbreak, and listen, and they're going to clinically diagnose you. Blood test would be if there's discrepancy. Blood test is going to confirm that you have herpes. Blood test is going to tell you the type 1 or type 2. Then there's also a swab when they swab the viral DNA. So you have to have an active herpes outbreak in order to swab it, in order for it to tell you an accurate answer. Your ex cheated and got herpes. Yeah, I mean, it's extremely common, unfortunately, especially when people cheat or just people don't know. Like, you don't really know who you got herpes from a lot of the times, because it could be something that was dormant in your system for a long, long, long time. So your ex that cheated may have actually had it this entire time. Not this entire time, but when you were with your ex, and it may have just shown up. How many times a year do you get an outbreak? I just answered that. So I was told by a partner from 6 months, just got diagnosed. Should I check? Yeah, she may have had it. Most likely she just got it, but she may have had it for a while, Jason. So yeah, going and getting checked. It's never a bad idea to get checked for herpes. Like, it's never a bad thing to know your status. It's never bad. Can you go to the doctors face-to-face and get checked out? Absolutely. Just go to any general practitioner, any minute clinic, anything like that, and they can look at it directly. And guys, thank you for the shares. I see that on my feed, so I appreciate the shares. Like I said earlier, if you know someone that needs to hear this, that's why I'm here. That's why I'm here sharing this information, so that we can no longer feel like we are ostracized, no longer feel like we can't be in relationships, that want to be in relationships, feel like we have to settle. I don't want anyone to feel that way. You're saying that yours never break out. That's awesome. Your body's doing what it's supposed to do. Pregnancy, yeah, it was, I mean, I don't know. It was completely normal I don't know what it's like to be pregnant without herpes, because I've had herpes for so long, but it was completely normal. I had a healthy baby. I pushed him out vaginally. And there we go. He does not have herpes. So what if you have herpes 1 but never had a cold sore in your life? You don't know where you have it. So if you have HSV1, you may have it oral or you may have it genital. You don't know. If you've never had an outbreak, there's no way to tell where you have it. So that's awesome. If you never had an outbreak, it means that your body's suppressing it. You can still transmit it. Unfortunately, it's still able to be transmitted. In fact, 70% of transmissions occur without an outbreak. So you do still have to disclose, but that's awesome that you're not getting outbreaks. Diagnoses are not valid via blood panel. They are and they are not. So there is a huge window of error, and that can play the role. When you get tested can play a role in that. So if you're getting tested, like let's say you were just exposed to someone that had herpes, like let's say you had a one night stand and that person had herpes and you freaked out and you went and got tested the next day. You're going to test negative. because your body hasn't had a chance to develop the antibodies. It hasn't come down with the disease, for lack of better words. Even if you've had your first outbreak, let's say you have an outbreak, you most likely will test negative because your body's going to come back. It hasn't created the antibodies. So that's another reason why you may test negative. If you're still in this purgatory of wondering what you have, or do I have it, do I not have it, the best way is called the Western blot, B-L-O-T, and that's going to be your most accurate way of testing. How did I get herpes originally? For oral herpes, somebody kissed me with a cold sore, and he kissed me with an active cold sore, and genitally, I dated someone who didn't know he had it, and so I got it. He didn't know he had it. Were you born with it? Nobody's born with herpes. It's not something that is hereditary. You don't it's not like passed down genetically from your parents. It's something that you contract outside of the womb. Why don't doctors act like it's a big deal? My friend found out he has the antibodies because it's not a big deal. It's not a big deal medically. It's a big deal for us emotionally, but it's not a big deal medically. It's a virus that the majority of the population has, and it causes annoying outbreaks. So that's kind of it's kind of what it is. You still get down, right? You still get down though, right? Sorry, I was misreading that. Yes, of course I do. Absolutely. The diagnoses are only valid via blood panel? No, you can do a viral DNA swab, and they can actually swab the active lesion. I'm scared to date with it. Understandably, I was too. That's why I stayed with the guy for 2 years. I was scared to date as well. I settled. It was a really bad relationship. You absolutely can date. You can date. You don't need to disclose you have herpes unless you're going to expose the person to it. So go out, date, have fun. If you're going to get in a relationship, a sexual relationship, then you absolutely have to disclose. But dating can be going for coffee, going for ice cream, going and doing these things, going out to dinner. You don't always have to have sex. So you eventually are going to get to that point, I understand. And that's when you would have the sexual health conversation about what are we going to do? How are we going to proceed here? How does my husband feel about me having herpes? He doesn't care. I mean, he's I'm sorry that you have to deal with this here and there, but he doesn't care. He doesn't love me any less. What did my HSV-1 outbreak look like? It started over here for me, and it was like a cluster of blisters that just kind of went everywhere when I first had it. The last couple times I've had it, it's just been a cluster of blisters right here. I've gotten shingles about 3 times sorry, the thing moved on me. You've gotten shingles about 3 times in a year, and your doctor says it's herpes complex. Any info? So shingles is herpes. It is part of the herpes family, and there's not millions, but there's thousands of viruses that are, not thousands, hundreds of viruses that are herpes viruses. We just call herpes the oral and genital. We refer to it as herpes, but the chickenpox virus is herpes, which eventually turns into shingles. Whatever virus. The Epstein-Barr, which is mono, is a herpes virus. There's a lot of other herpes viruses out there. What if you're pregnant? Enjoy having herpes. You need to be on the same page as your doctor. Absolutely. You and your doctor and your partner need to come up with a plan for delivery, but you can still have a beautiful birth. It shouldn't interrupt it, but get on the same page as your doctor and see if your doctor's yeah, I feel more comfortable doing a cesarean, or your doctor's no, we can totally do a vaginal birth, whatever you feel most comfortable with. If you have an outbreak, you can't have a natural birth. I don't think it has to go so if you have an outbreak, you have to have a cesarean. They're going to require you to have a cesarean if you have an outbreak, but if you don't have an outbreak, you can have a vaginal birth. Absolutely fine. How did I get herpes? I had sex with somebody that didn't know he had herpes. So 90% of the people with genital herpes don't know they have it. Genital HSV1 is like the up and coming thing. Not that that's like a good thing, but it's extremely common. I did a random poll. This is not official, guys, so don't like go quote this, but I asked my Instagram community if they have HSV1 oral or genital, and 80% have it genital. Is there a cure coming? I believe there is. I mean, like, they didn't just like call me. The CDC was talking about it last week. There will be some sort of a medication or a way to make it go dormant. A cure is a very strong word. We can't cure viruses at this point. So like people with hepatitis, they're not cured of hepatitis, it's just dormant in their body. So that's a very strong word, but there will be some sort of, in my opinion, there will be some sort of medical treatment that can allow us to allow it to go dormant or can prevent transmission to partners. Can you get tested if you don't have an outbreak? Absolutely. It'd be a blood test, and you can absolutely do that. They told you there's no test for herpes. That's inaccurate. There is a blood test or or you can swab the viral DNA. How common is it to get a false negative from a swab? I don't know that. If they swab so a swab can be tricky because if you swab too early, you can get negative results. If you swab too late, you can get negative results. So you need the active outbreak. Thank you for the follows, you guys. I appreciate it. And if you know anybody that needs to hear this, please don't hesitate to share it. I just appreciate you guys listening and wanting to help break the stigma is exactly what I'm doing. Does lidocaine help with the pain? I've never tried lidocaine, but anything with cane, like it is a pain relief. So I would definitely try it if you think that's going to help. People should ask their potential partners to get tested. Absolutely. You should have that conversation with your partner and ask your partner to get tested. What percent of the population has herpes? So 67% have HSV1 and 13% of HSV2, which comes to about 80% of the population has herpes. Is it true that HSV1 genital is less transmissible the longer you have it? All herpes is, I wouldn't say less transmissible, but you're less likely to have outbreaks and there's less shedding, which in turn would mean that you are less likely to transmit it, but you're still able to transmit it. So, but the longer you've had it, the less likely you are to transmit it. If you're most contagious or most likely to transmit it, if you don't know you have herpes, so like you're not communicating with your partner or it's new in your system. Can you pass it during childbirth? You can. That's why your doctor will most likely put you on the antiviral during the time of delivery. Have you ever heard of the antibodies? No, I have not. I don't even, missing SARS-CoV-2. I have not. They didn't tell him to take any meds or anything. I just thought that was weird. My husband got it on his head. How did he get it there? He must just come in contact with it there, or it also travels along our nerves. So I don't know what head you're talking about, but it travels along our nerves. So the herpes virus will follow the nerve ending and go kind of wherever that is. Kissing too, right? So if you have oral herpes, you can transmit oral herpes via kissing. It can be spread to any part of the body. Yes, it can. You have to have a reason for it to go there. So like, let's say, I'll use my son as an example who does not have herpes. And let's say he falls down and scratches his knee. And let's say I have a cold sore, an active herpes outbreak, and I kiss his scraped knee with my active herpes outbreak. It could potentially go to his knee. It is an open wound with an open sore, and that could be a barrier of entry for that herpes virus. So it would then probably go to his knee. But most likely the herpes virus likes the oral and genital locations. Is it hard dating with HSV2? I mean, it was fine for me. I definitely had rejections. I definitely had, and I also had positive disclosures as well. So It just depends on how confident you are and how much you set it up with sexual health. Like, are you going to set up the sexual health thing? Do you have HSV1 or HSV2? I have both. I have HSV1 and HSV2. If you've had mono, will the blood test positive for herpes? I don't believe so. It's different antibodies, it's different viruses, but I have heard where like the chicken pox, people have sometimes accidentally tested positive, but I would definitely ask your doctor. That's a lie. What medications do you take? So you can take the antiviral that's prescribed to you by your doctor. If you're taking it daily, it's a prophylactic. It's 500 milligrams daily. Typically, if you have an outbreak, it's 1,000 milligrams, 500 in the morning, 500 in the evening. I am not a doctor. I cannot prescribe. I cannot recommend. I advise you to go do your own research. Personally, what I do is I take lysine and monolaurin daily. These two things are something that I personally swear by. Again, I'm not a doctor. These are supplements. If you have questions about supplements, definitely do your own research. But lysine, which is the one right here, is a protein. It's essential amino acid. This protein is basically threatening to the herpes virus. It helps prevent the replication of the herpes virus. We have the herpes virus in our body that wants to replicate, means it wants to cause outbreaks. This helps break the replication. It helps block the replication. Then we have monolaurin, which is lauric acid, which basically disrupts the outer layer of an enveloped virus. When you have an enveloped virus, which means it has an outer shell around it, I think of an egg. An egg has an outer shell. Our immune system cannot penetrate the enveloped virus. Enveloped viruses include COVID, it includes the flu, the cold, and herpes. So this helps disrupt that outer layer, and so it allows our immune system to go in and penetrate. So these two things I take daily. I swear by them. I do have them linked for you if you want to check them out. You can use the promo code and they have 10% off for you, or I have 10% off for you. So that's what I take. Have I done research on the red laser? I have. I've done a little bit of research. I think that any type of thing that's going to lower inflammation, it's going to help your overall zen, I think is extremely helpful. I do have a red laser, but I like those beds you can go into, I think would be amazing. You thought Valtrex already makes it dormant. Valtrex does, but it is a medication you have to take, opposed to teaching your body to do it naturally, and you can either take some supplements that can help it. Is being on Acyclovir a foolproof prevention? I've had it for a few months and on the meds. So nothing is 100%. It's like birth control. Like, it's not 100%. You can still get pregnant with birth control. You can still transmit herpes on the antiviral, which is Valcyclovir, Acyclovir, or Valtrex. However, being on the antiviral is, according to the FDA, the best way to prevent transmission. It lowers the transmission rate by 48%. If you've had how soon before treatment for the dormancy? If you take the antiviral, it should help with either symptoms of an outbreak within the first couple hours. How long does it take to go dormant? I mean, it's taking a medication every day. I'd say a couple days. Does lysine help prevent transmission? Yeah, it helps keep the virus dormant in our system as well. You wish you were my socks? Thank you. I don't have socks on, but you've had a difficult time accepting your diagnosis. I completely understand, and I have as well. Like, I get it. It's frustrating, but it's part of going through life, and a lot of it is based off decisions we made. I made those decisions. No one made them for me. I knew there was STIs out there. We have to take responsibility for our actions, and we also have to practice forgiveness to our partner who either did or did not know, and to ourselves. Like, I forgive myself for making those choices. So that helps me get through the diagnosis. All right, guys, I'm going to go. I really appreciate you being here. I just saw here, is the antiviral really 90% effective? The antiviral is going to lessen the transmission rate by 48%. So I don't know about 90% effective, but it's going to lessen the transmission by 48%. I appreciate you. Like I said, if you know someone that needs to hear this, please share it with them. And of course, follow. I will be live daily. I do my best to go live daily. I'm a mommy, so I get really busy sometimes. But I appreciate you. Thank you. Thank you. Thank you. Thank you for the hearts. Thank you for spending your time. And I will see you soon. I'll see you soon. Yeah. All right. Super random. If you're a Netflix and you haven't seen The Watcher, go watch The Watcher. It's creepy and it's a true story. All right. See you tomorrow. Bye.